Hello, everyone, and welcome to the first 2023 Kapnick Strive monthly webinar. My name is Lexi, and I am joined with Emma and Jen today, and the three of us will be your presenters. Today, we'll be discussing how to have a more positive, empowering experience when you're encountering the healthcare system. We know that seeing a doctor and being a patient can be scary, especially if you've had a negative experience in the past. So throughout our webinar today, we'll define the tenets of patient experience and empowerment. And we'll also provide you with some practical strategies that you can implement to help ensure more positive experiences as a patient. So starting off, what is patient experience? The Barrel Institute defines patient experience as the sum of all interactions shaped by an organization's culture that influence patient perceptions across the continuum of care. In plainer terms, patient experience is your overall perspective of your various encounters with the healthcare system. Positive and negative experiences over time shape our opinion about the medical system. So ask yourself, can you think of a time when your doctor ignored you? What about when a pharmacist was especially kind or understanding? How about when you had to pay for parking at the hospital or had a question answered by your health plan? The sum of these interactions, whether it was with a surgeon or administrative assistant at your doctor's office, comprise your patient experience. And although you might have been able to recall some positive experiences in healthcare, it's not uncommon that people share feelings unheard, unsupported, or unseen by the medical system. And these negative experiences aren't without consequences. Patients' experience has a tangible impact on population health, population-level health outcomes. So why does patient experience matter? So sure, everyone would like to have a better experience at the doctor's, but why does it actually matter? As it turns out, there's some persuasive clinical data to back the importance of improving patient experience. And according to the Federal Agency for Healthcare Research and Quality, patient experience is positively associated with processes of care for both prevention and disease management. For example, diabetic patients demonstrate greater self-management skills and quality of life when they report positive interactions with their providers. And patient experiences with care, particularly communication with their providers, is also associated with adherence to medical advice and treatment plans made by their doctors. And this is especially true among patients with chronic conditions, where a strong commitment from patients to work with their providers is essential for achieving positive results. And lastly, patients with better care experience often have better health outcomes. So, for example, studies of patients hospitalized for heart attacks showed that patients with more positive reports about their experience with care had better health outcomes a year after discharge. So to summarize, having better experiences with your providers may help you stay on track with managing chronic diseases, improve your quality of life, motivate you to follow treatment plans more closely, and improve health outcomes. In a perfect world, everyone would be having amazing experiences with their healthcare providers all of the time. However, we know that the complexities of the US healthcare system present a larger barrier to improving your patient experience. So while we wait for structural changes to occur, we can work towards being more empowered patients, which involves advocating for better experiences ourselves. According to the World Health Organization, patient empowerment can be defined as a process through which people gain greater control over decisions and actions affecting their health. While the term has turned into a buzzword in healthcare in recent years, it works to emphasize the value of having patients assert greater control over their health and health care. And the Patient Empowerment Network has defined 6 essential components of empowerment that, when present, can facilitate more positive experiences in the healthcare system. So we're going to cover each component in the following slides. First, information is fundamental to the process of patient empowerment. As you might imagine, it's hard to make a decision about your personal health when you don't feel like you have all the facts in order. Research shows that access to the right information at the right time, delivered in the right way, leads to an increase in a patient's desire and ability to take a more active role in decision making. Open and transparent communication and access to a patient's own medical records is a key driver of patient empowerment. Second is health literacy. While access to information is a key driver of patient empowerment, health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So even though you have the information, if you don't have the tools to understand it, it may not be helpful. And although doctors should communicate clearly, it's normal to need clarification, especially if the doctor is not speaking in your native language. And for this reason, translation services are legally required to be provided if needed. I'm now going to pass it on to Emma.
So up next, we have self-efficacy. Self-efficacy is your level of confidence in your ability to complete a specific behavior. So in the context of healthcare, it's your belief in your ability to change health behaviors so that you can achieve your personal health goals. These health behaviors could be anything from taking your medication to eating better. Developing a sense of personal control over your health is in itself empowering. The empowered patient is confident in their ability to manage their condition. When unsure about where to go or what to do next, they will feel confident to ask questions of the healthcare professionals providing their care. This confidence comes easier to some than others, but everyone has the ability to increase their self-efficacy in a healthcare setting. Mutual respect in a healthcare setting is a partnership approach that seeks to balance clinician expertise with patient preference. It recognizes that while healthcare professionals are the experts in their knowledge of a disease, patients are the experts by experience. The empowerment process is about sharing both knowledge and experiences to set new goals and learn with and from each other. While not all healthcare professionals are using this approach today, the best doctors will be willing to get to know you as a person and listen to your concerns and experiences. This sense of mutual respect is really crucial to having an empowered, positive patient experience. And next, we're talking shared decision-making. This is the conversation that happens between a patient and clinician to reach a healthcare choice together. Examples include decisions about surgery, medications, self-management, and screening and diagnostic tests. There is significant research that suggests that health outcomes are better in patients who are more involved in decisions about their treatment. In this model of decision-making, the clinician provides the patient with current evidence-based information about treatment options, describing the potential risks and benefits, and then allows the patient to express their preferences and values. Again, while not all clinicians may be implementing this framework in their practice, you are likely to have a better experience with a doctor who listens to your concerns and takes your preferences into account. If you don't feel listened to by your doctor, you may find a better fit elsewhere. Feeling supported in a specific healthcare environment is a key component of patient empowerment. Many patients would like to take more responsibility for their own health, given the opportunities and support to do so. Empowerment does not happen in a vacuum. It's a two-way process. The patient needs a counterpart, the clinician, who welcomes the patient's involvement and knows how to create an empowering healthcare environment. Again, if your doctor does not welcome your input or create an inviting space, there may be better options available somewhere else. And lastly, we have barriers to patient empowerment. So there are many reasons why not all healthcare interactions are positive or empowering. The first common barrier to patient empowerment is short appointment times. It can be difficult to encourage open communication, shared decision-making, and room for sharing your experiences when your doctor is pressed for time. Next, many physicians today still operate in a way where they tell you what to do without allowing any input or questioning, in essence, making demands of you. The lack of physicians trained in empowerment techniques can set people up for having less positive experiences. And lastly, many people experience some level of anxiety in a healthcare setting. This can make it more difficult to advocate for yourself alone. Now that we've discussed the primary tenets of what patient empowerment looks like and some barriers to patient empowerment, I'm going to pass it off to Jen to discuss some practical strategies that you can implement to feel more empowered in a healthcare setting and improve your experience as a patient.
Hi there, everyone. So there are a variety of reasons why healthcare interactions can be either positive or negative. And the first common, oops, sorry. That's what Emma just covered. There we go. So like Emma said, we're working on tight schedules with doctors. So it's a good idea to know ahead of time what topic or area you want to be covering. Before you have an appointment, give yourself a few days to collect some notes so that you're prepared. You can even prioritize them in order of importance or urgency. So for instance, if you have a standing doctor's appointment for a knee issue, but you're also experiencing some sinus congestion, which one do you really need to talk to the doctor about first, and then what will come after with the available time? You might want to create a list of specific questions for each of those topic areas and have any notes about relevant symptoms. You know the doctor is going to ask, when did this start? When did you first notice this? So having an accurate list of symptoms can be very helpful as your doctor is working to diagnose whatever is going on for you. Coming to your appointment prepared allows you to have all of your pressing questions answered, and it creates an environment of equal communication so that you're part of the decision making, and that will make the experience as a patient more positive overall. For example, I have my doctor's appointments set in my calendar on my phone. Anytime I have a thought or a question about my health and wellness, I open up that appointment and I add it to the notes so that all of my notes are in one place and I'm ready with them at the doctor's office. It'd be ideal to cover every topic in person with your doctor, but it's okay if there are some things that didn't get touched on. You can always address remaining concerns in a portal message. Those messages go directly to your physician's inbox, like an email, or in a follow-up appointment. So definitely make sure that all of the topics that you need covered are addressed between the appointment and any follow-ups that you need. And you can go to the next slide. Thank you. So we know what to do before the appointment. Now that you're in the appointment, you want to make sure that you are completely honest with your doctor about any symptoms or events that have led to the specific medical issue that brought you in that day. Ask your questions, request evidence or testing from your doctor, and be sure that you feel heard. Once you've shared everything, then it's time to listen closely to your doctor's recommendations. You can take notes or set up an audio recording on your phone so that you can reference what they said later. Remember that while your primary doctor is a fabulous resource, there are also many specialists who might have more experience with the medical issue at hand. So if you feel unfulfilled with your doctor's answers, you can follow up and ask for a referral to a specialist. And next slide. After the visit, this is a good time to take a look at your doctor's notes. They will often print them out for you at the end of the visit, but you can also find them in your patient portal. That way you make sure you didn't miss anything from that visit. If you're still unsure about a health decision that you and your doctor discussed, it never hurts to seek a second opinion from another expert. You can find other routes of treatment elsewhere that could be better aligned with your goals. And lastly, take a moment to reflect on your experience. If you didn't feel like your doctor communicated effectively, that they ignored your experiences or preferences, or didn't offer a welcoming environment, it's okay to look for a new doctor where you might have a better experience. And lastly, if you have a negative experience, share your feedback with the clinic coordinator or ask the clinic staff how to give feedback. This is a process that should work for you as a patient, and if it's not, then the clinic and the doctors need that feedback to make adjustments. And then we've got a couple of resources for you here. The Patient Advocacy Handbook. Inside our steps for becoming an effective advocate in the healthcare system. It's helpful in inspiring you to believe in yourself and your abilities. It will give ways to overcome any intimidation that you might feel in that medical setting, in that healthcare setting, and offers tips and insights for taking care of yourself if you are an advocate and caring for a loved one. The Empowered Patient Podcast. This is a window into the latest innovations in digital healthcare and kind of how the dynamic is changing between doctors and patients. So you'll see really great episodes in that podcast. And then the last one is Patients Rising Podcast. And this brings a established brand of patient advocacy weekly in their episodes, featuring just helpful discussions about issues that impact those with chronic illness. And we thank you so much for joining us this afternoon. Don't forget to tune in February, the 22nd. That'll be Wednesday at this same time, 12 p.m. Eastern Standard, because we'll be talking about investing in your health and what a worthy investment you are. Thanks, everyone.